How to measure patients for Activa and ActiLymph compression hosiery. When it comes to preventing venous disease progression, every moment matters, so make sure you're choosing the correct compression products for your patients. In this video, we'll demonstrate how to measure your patient's leg and show you how to order the most appropriate hosiery for their needs. Step 1. Assess your patient. Before choosing the hosiery, you will need to carry out a full holistic assessment, including a vascular assessment, to make sure your patient is suitable for compression therapy. Step 2. Choose the style. It's important to choose the correct hosiery style for your patient's needs. We worked with clinicians to develop the cross-checker, which makes it easy to decide which hosiery to use and when. It's available as an app or as a paper form. Simply select the relevant symptoms from the list to find the most appropriate hosiery for your patient. For example, Activa hosiery is ideal if your patient does not have edema, whereas ActiLymph is suitable for those patients with edema. Step 3. How to measure. It's best to measure early in the morning so that you avoid any build-up of edema. If possible, your patient should be standing with their weight evenly distributed through both legs. You should stand in front of the patient, where you can visually assess the shape of the limb. All measurements should be in centimetres. Place the tape snugly against your patient's bare skin and move outwards from the centre of the body. In this example, we will be measuring for thigh-length hosiery. Start approximately 5 centimetres below the groin and record the circumference. Take a measurement at the widest part of the calf muscle. Measure just above the ankle bone. Measure from the back of the heel to the longest toe. If this is difficult, ask your patient to stand on a piece of paper and mark the front and back of the foot. Then measure the distance between these 2 points. ActiLymph hosiery is available in 2 lengths. For below-the-knee garments, you'll also need to measure the distance from the popliteal space to the floor. In the majority of cases, you should also measure the other leg. This is particularly relevant if you're treating a leg ulcer. Applying hosiery to the other leg could prevent further disease progression or another leg ulcer from developing. Step 4. Record the measurements. Now you can make a note of the measurements on the hosiery record form or the L&R hosiery selector app. If your patient does not fit into a standard size or the limb is distorted due to edema, a custom-made garment such as the ActiLymph made-to-measure or an adjustable wrap system such as ReadyWrap may be more appropriate. The L&R hosiery selector app produces your patient's size instantly. Simply input the measurements and it does the rest. With just a few taps, you can also select the most appropriate product, style, and class for your patient. Download it for free from the App Store today. L&R compression hosiery to prevent disease progression. Every moment matters.